السلام عليكم أعزائي الطلبة. اليوم محاضرتنا بعنوان Replacing Missing Teeth with Fixed Partial Dentures. Diagnosis is the most important part for any procedure. So this part will come into different examinations like intraoral examination, then extraoral examination, radiographic examination, and the diagnostic cast, diagnostic workup sometimes needed, and also, and very important, the aesthetic consideration and functional consideration to be done. Finally, we can come to interdisciplinary consultation and negotiating the treatment plan with the patients. Aesthetic considerations. We must understand the patient aesthetic desire. It's very important to understand the desire of the patient. Very important because sometimes we think that the treatment plan will become more aesthetic from our point of view, but for the patient is not satisfied with this result. So the patient desire is very important. Also, we take in mind the position of the prosthesis, which arch, which tooth to be restored. Also, there is a very important element include tooth shape, symmetry, shade, retainer selection, material, amount of tooth coverage, and the margin location. It's very important part to negotiate during aesthetic considerations. Functional considerations. The type and number of abutments utilized for the future fixed prosthesis require functional considerations. Here, we must take in our mind there are two types of retainers, the intracoronal or the extracoronal retainers. Each retainer will need specific steps and specific need, and according to the functional stresses applied and the age of the patient. Sometimes patient with deep bite or proximal clenching at restored, as we know, the parafunctional habit and what cause to the appliance with excessive stresses may lead to fracture. So this functional consideration must be kept in mind during treatment planning. The treatment options, we can summarize it according to retainers and pontics. The retainers come into partial coverage or completely coverage, okay? While the pontics, we discuss the design, the edentulous rich form, and the materials. We now start with the retainers. The retainers, all we know that retainers, factors for selecting the appropriate retainer is aesthetic, biologic considerations, and functional and mechanical considerations. About the biologic and mechanical considerations, the size of abutment tooth is very important, the amount of the remaining tooth structures, the status of the pulp, the clinical crown length, the location of the tooth in the mouth. These are factors should be kept in mind for mechanical consideration of the retainer. The type of occlusal load, the interocclusal space, the opposing dentition, and the edentulous span length. And this type, here, there is a deficiency and a black triangle here. Also, there is a difference between the level of the incisal edges and the prominent central here. So, after removing the fixed denture, we can see the abutment in very good health. Some problem with the tissue here, need surgical correction. Some preparation in the abutment teeth in order to take a full emergence profile. Natural contours we need to take as seen in this picture. Take more from the abutment and correction with tissue correction. Then this final result as seen is very beautiful final results. Also we can notice this lateral came with veneer. Why we take veneer in this side? In order to make more prominent laterals to be in coincidence with the fixed denture here. Okay, so this is the final result and very good and pleasing results. Partial coverage retainer. About the type of the partial coverage retainer, we have metal partial coverage retainer. The metal either inlay, onlay, or 3/4 crown. It is, as we know, the metal is less aesthetic and very limited use nowadays. The most widely used partial coverage retainer is the resin bounded retainer. Resin bounded come into two main types: short-term provisional restoration or long-term restoration. Short-term provisional restoration is a prepless bridge. Prepless bridge. There is no need for a preparation here, depending almost in retention for the resin bond to enamel. While for the long-term preparation, we need a preparation like the 3/4 crown, and we need here to make more retention and resistance forms to permanent long-term restorative option. Very important to know that the properly constructed long-term resin bounded fixed bridge denture have fallen from favor, just as traditional partial coverage. So it is not widely used. For long-term resin bounded partial veneer fixed denture, as we call it, the Maryland, okay, the Maryland denture, particularly in the interior part of the mouth. The abutment teeth are aesthetically acceptable from size, form, and color. The abutment teeth, very important to know that the abutment teeth should be in acceptable size and form, because if we have an absence or loss of central and we want to restore it, the lateral and the other central should be in acceptable size, form, and color, and free of restorations. Okay, the abutment should be of adequate length for good resistance and retention. The adequate thickness also. The teeth should have minimum mobility. Okay, so the failure rates for such restoration with an increased number of pontics and with mobile abutment teeth. Very important to have long-term success. We should restore one tooth. One of the most frequently aesthetic challenges with this type of retainer is the difficulty of shade matching. Very important here. The restored tooth will be covered by metal palatally. Okay, so this metal will diminish the light translucency, resulting in possible shade variance. The porcelain veneer. The porcelain veneer. Here, the veneer, all the tooth will be porcelain. Okay, It is one of the most aesthetic of all partial coverage restoration, but has limited long-term clinical studies. Connector dimension, here very important to know, the connector dimension need sufficient space, 3 by 3, okay, 3 by 3 millimeter width and length, has a favorable fracture resistance because there is no metal here in that type of restorations. Based on several in vitro studies, the clinical performance of cantilever resin has been shown to be superior to the two retainer designs. Very good, very good. In some studies showed that a clinical performance of cantilevered resin very superior to the two retained design. Let's see this case. This case for female 17 years old girl seen with missing laterals. Missing laterals. This one and this one. As you see from this frontal view, there is a decrease in the length. Okay? And we need here to increase the length of the laterals in order to achieve the good zenith and good gingival margins. So, as we see in picture C, retracted view after removal of resin bonded pontics. After removal of the pontics, we see these teeth, and here the bonded zirconia in picture D, adhesive bridges with improved pontic contours and more harmonious proportion. So the patient was very satisfied with the stronger framework and improved aesthetics. The phase 1 treatment, return back to picture C, the phase 1 treatment included fabrication of partial coverage adhesive zirconia bridges to replace the maxillary lateral incisor. Phase 2 treatment with augmentation of the edentulous ridges and implant crowns to replace both lateral incisor. The phase 2. So, augmentation of the edentulous ridges and implant crowns to replace both lateral incisors. Complete coverage retainers. Complete coverage retainers. After we discuss the partial coverage, now we discuss the complete coverage. As we know, the full veneer retainers are the most popular of all retainers. It is better than partial coverage from mechanical, from aesthetic point of view. They generally fall into 3 categories: all metal and all ceramic, metal to ceramic retainers. The all metal crowns are not particularly aesthetic. As we see in the partial coverage, the metal is not widely used. Also, the all metal from from aesthetic point of view, low aesthetic demands in such crowns, and not very widely used. But I think sometimes we need metal crowns in specific situations, like for example you don't have enough space, interdental space or other, so some situations make us to make all metal crowns even nowadays. Okay, the major advantages of all metal retainer are less tooth reduction compared with metal ceramic and all ceramics. Okay, at the same time have enough strength, and also there is lack of wear of the opposing dentition. While the chief disadvantages is the lack of aesthetics and high thermal conductivity. Fully centered zirconia blocks are more difficult and time-consuming to mill, but are not subject to the dimensional changes that occur with the green stage and the pre-sintered zirconia materials. So computer, now we talk about the zirconia bridges. The zirconia bridges, it is very favorable bridges and very widely used nowadays, because as we know, zirconia has a good flexural strength and a good toughness, so it can be used in full frameworks, not only single crowns. And the computer aided design nowadays, CAD/CAM technology, it makes the fabricate of zirconia based restoration very easy and with perfect fitness and good and very good aesthetics with joints, especially joint in cutback technology with porcelain. So precise tooth preparation with rounded chamfer margins should be done. Why we need a round shoulder? Because the sharp exiogingival line angles very difficult to scan and may result in compromised internal and marginal fits. Okay, this is very important thing to you. 15-year-old male here was congenitally missing his laterals, also congenital missing laterals. After removing of the laterals, okay, we prepare the canines and we make zirconia هنا, as you see in picture C, right and left CAD/CAM zirconia frameworks seated on the master cast, and you can see the space between the lateral and the central here, and also this is space because the width of the centrals is not wide enough, so we need to widen the central also. So in the final restoration seated here, what we do, we make crown on the canine and pontic lateral, and also we made an addition non-prep veneer. Note the conservative restorative choice were provided to allow for a growth and additional option in the future. Since we tell the age is about 15 years, so we need 3 more years until we can make an implants for the lateral. In that time we don't want to prevent any growth and development, so we make a cantilever in a way or another, framework of zirconia, okay, crown prepared, lateral pontic, and we also make a non-prep veneer on the centrals, both centrals, to restore the normal width and aesthetics of the anterior teeth. As you can see here, the space and the insertion of the right central non-prep porcelain veneer, okay, then the final result is very pleasing result. You can see the decrease in length of the zenith of the canine. I think it's need to surgical correction, but since the patient is 15 years, they need after 3 years after implant, we can fix it and we can use the final solution from surgical correction, and final aesthetic results will come. The marginal fit of zirconia based fixed partial denture can be equal, as we said before. It is very good marginal fit to metal ceramics. The high survival rates is very good. The most commonly reported complication is chipping of the veneering porcelain. This is the most problem faced the zirconia, chipping of the veneering porcelain. As you know, the zircon will covered by porcelain for give him the aesthetic appearance. Layering of the porcelain on the zirconia. Chipping of the veneer is the most commonly reported complication. This is often attributed to inappropriate support. What is the causes after this chipping? There is no enough zirconia to support the veneer. This is the most cause of such failure. Although temperature control and ceramic compatibility may play a role as well. Future fabrication methods involving pressing the zirconia coping may improve the clinical outcome currently seen with the traditional layering technique. Okay, for improvement, pressing the zirconia coping may improve the clinical outcome. Recent improvement in the second generation here, the lithium disilicate ceramic material. The lithium disilicate ceramic material, smaller size, more homogeneous, more improved physical properties like flexural strength, fracture toughness. This is increase the chances to use as a 3-unit fixed partial denture, 3-unit ceramic to replace anterior teeth and the premolars because of these physical properties. By far the most commonly used retainer for fixed partial denture is the metal ceramic crown. Metal ceramic crown, metal fused to ceramic, is the most widely used retainers. The location of the margin in relation to the gingiva. Very important to know some of the variables that should be considered with the metal ceramic. Metal ceramic, you should learn 3 important points: the location of the margins in relation to the gingiva, the materials utilized, and the location of the porcelain metal junction on the occlusal surface. Very important 3 points: margin location, materials used, and the location of the porcelain metal junction on the occlusal surface. Let's see the margin location. The margin location, the best biologically accepted margin, as we know, while the margin is supragingival, we are in a good position. Why? Because it's easily cleaned, can be take impression easily, can be prepared easily. All thing is very good. But what is the problem with supragingival margin? Is the poorly aesthetic. So in some areas where not aesthetic is demanded, we can use the supragingival margins. Sometimes it's not aesthetic the only cause for making subgingival margins. Sometimes we need subgingival margins in order to elongate the crown for better retention. Sometimes we need to elongate the crown to remove or to become to make the margin beyond the restoration, beyond the caries on sound tooth structure. So we need to make the margin subgingival. The subgingival margin is more aesthetic, but in metal ceramic margin, if we extended the metal subgingivally in order to hide the metal color, sometimes the thin biofilm tissue will make it clearly visible and making a grayish color on the gingiva. So it is not aesthetically enough to make it subgingival. For any margin location selected, the restoration objective is to create precise, well-fitting margin. Very important for any location should be well-fitting margin. This ensures the longevity of the restorations and idealize periodontal health. Very important to know not only the location, should be well-fitted margin. As you see here in the radiograph A, there is ill-fitting margins and some periodontal problem corrected by figure B with good fit and new restoration, well-sealed margins, ideal for long maintenance of periodontal health. Now we discuss the margin material. First, the margin location, then the margin material. The margin material, not all subgingival margin result in aesthetic outcome. That's what I call it. Not all subgingival margin will result in aesthetic. As we say, sometimes the thin biotyped tissue will result in poorly aesthetic for metal. So, we have three different approaches to metal ceramic crown margins. What we do in order to enhance aesthetic. The first is the classic. We made the metal collar. The metal collar is very good for fitness, it's very good for mechanical support to the occlusal load, but it is not good for aesthetic purposes. The second approach, in order to avoid the color of the metal collar, we make a porcelain in front of the metal. But this approach is not good. Why not good? Because the porcelain will be in thin section here at the collar. This thin section make it usually not polished, okay, and it is made of opaquer only. The opaquer is not polished, rough surface, and accumulation of food, accumulation of a plaque on the surface will gone and make it more inflammatory changes. At the same time, the thin section maybe for metal will not provide enough support for the porcelain at this collar. Also, the metal may be diffuse during sintering or firing of the porcelain on it because of thin section. So it is not good approach. The third approach to achieve an aesthetic metal ceramic crown margin is the porcelain margin. What we do here, the collar is not made of metal here, it's only of porcelain. So the metal will not reach the end of the preparation. We made a cut back metal supportive coping to the internal line angle of the shoulder of the preparation as far proximally as is required for aesthetic and for the creation of porcelain shoulder. Here we give a good enough thickness of porcelain, okay, for support, and we prevent the metal from reaching these sites to be in this section. Studies showed that porcelain, when cemented on the tooth, the porcelain will have good strength and possibly maybe greater than metal collar margins. So, as a summary of what I said before, we can conclude that our recommendation for margin selection of metal ceramic retention to use metal collar margin aesthetically non-critical areas. Porcelain margins should be used in the patient aesthetic zone. Okay, and the combination metal porcelain margin should be avoided whenever possible. As you can see in this case, patient come with severely attrition sites here. Okay, very bad aesthetic results here after making surgeries. Tissue surgeries, very important in fixed prosthodontics, to make tissue surgeries, pre-prosthetic surgery here, to enhance the tissue problem, the pocket, the recession of the gingiva, okay? Then you make the final precision. Here the temporary, and we can see the final results. As you see here, very marvelous final results. You can see where the recession in the previous picture and now after treatment. So aesthetic restorative object could be achieved once the pre-existing tissue recession issues were corrected with connective tissue grafting procedure. Very important periodontal health for fixed bridges. Porcelain metal junction. Porcelain metal junction, the third part that we discuss after margin location and margin material. Here the porcelain metal junction cover the entire metal with porcelain is very important for aesthetic. But this require sufficient metal thickness to support the porcelain from occlusion. The porcelain metal junction location on mandibular anterior restoration is rarely of importance. I discuss now with you the lingual side. The lingual side is not very important for aesthetic point of view. So we can make the color lingually as more incisively as possible. Okay? About the porcelain fracture and porcelain wearing of opposing natural dentition, if the person was with a mutually protected occlusion in lateral and excursive movement, there's no need to protect the teeth from wearing. But if it is not, you must make an occlusal supplant here. You must fabricate an occlusal supplant to protect the teeth from wearing. Patients' porcelain metal junction location on mandibular anterior restoration is rarely of importance aesthetically or functionally, biologically, owing to the small size of mandibular anterior teeth. Over contouring of the lingual surface of the restoration is best avoided by locating the junction as far incisively as we say before.